So as you look at, let's say, let's go writ large into more the health infrastructure of the country. If you were going to triage the system, would you look first to the sort of broader based, we shouldn't be a for-profit system, or would you look at it and say, it's about coordination? If you were to reorganize and restructure us, triaging that system to make it more reactive, responsive, and prophylactic to some extent, what would you address first? What would be the most dire need?
What comes first to mind is our healthcare staff, who we forget about, like the personnel. They've gone through such trauma. They're having a lot of difficulties. We have shortages of health workers in really important areas. So there's been rationing in some ways of care, or a lessening of the quality of care, for example, during COVID surges. So we really need to look at our health workforce and support that. So when we think about infrastructure, it's actually people as well.
How far behind are we? And if this pandemic doesn't ease, or if monkeypox or whatever they've got next coming for us doesn't ease, how do we invest in and get these people, the people that are already working there, some type of care to preserve their sanity and their well-being, and two, bringing in the next generation of workers?
I think it is mostly about supporting people in their jobs properly. That's my understanding, and paying them well and giving them the kinds of support that they need to do the jobs that they have trained to do. And so when I speak with health providers, these are the kinds of things that they cite. And it's also about all of us. It's about Americans. If we're talking about the U.S. specifically, it's about us supporting them. And there have been, there's been such a breach of trust during this pandemic. We talk about it with all sorts of, professionals, whether it's trust in leaders and political leaders and journalists, but in public health, officials who are attacked and denigrated, but also the health workforce, believe it or not, it feels the same way. I spent a lot of time in hospitals. I'm working on a book now about COVID. And I've seen some of those tensions where, this health provider has been your provider since you were 5 years old. They're the family doctor in town, and you trust them to prescribe, your diabetes medicine, and you listen to them. But when it comes to a vaccine for COVID, you will believe something that you see on social media over your trusted doctor. Why is that? That is very hard for health professionals. Or when people have gotten sick from COVID after, not being vaccinated perhaps, and then wanting a whole suite of treatment sometimes that the doctors don't believe it has efficacy, that they don't believe it will work. So some of that is also adding, or has added in these recent years.
Yes. You are being so polite about this right now. I'm very impressed with how polite you are, and not just saying, well, the first thing we need to do is get crazy people off of Facebook. Get them off. It's, I saw this in the local hospital here. When the pandemic first hit, man, the signs went up. Healthcare heroes work here. And the fire departments would come, and at the changing of the shifts, everybody would stand outside and they would do a clap. And it took about 8 to 12 months. And I remember driving by one day, and it was probably around the election had ended, and so we were past that, and the toxicity within the public sphere was so high at that point. This was post January 6th. This was all these things that happened. And there was a group of protesters in the same place of honor that they stood, standing by those now weathered signs that still stood as healthcare heroes work here. And they were protesting the nurses and the doctors so imagine you've just gone through hell. You've watched people die. You've been helpless. You've done everything you could to keep people alive.
Risked your own life before vaccines. Yeah.
You risked your own life. And now, not only are you not being hailed, you're being attacked.
Right.
Right outside your place of work. And I remember thinking, well, this, on an emotional level, this must be infuriating and maddening and also despairing.
You're so right. You're so right. That's exactly what I saw in the hospital. So that this is a piece of it. And this gets to, in any disaster, any emergency, it is all of us. We have to respond. We have to do our part, or else there will be what we've seen, which is a horrific burden of death and suffering that is avoidable.
We've hollowed them out. We've in some ways hollowed out our own healthcare system by being so unforgiving of the science not being exact or perfect.
Yeah, and I think in journalism, maybe we didn't do enough to prepare people for the idea that this was a new disease and that something you hear today about it might not be the same as what you hear tomorrow, because science will advance, and also the virus will change potentially. And we've seen that. But I think maybe people lost trust because they weren't prepared for, in fact, and this is always in whatever emergency, that you have to be flexible, and you can't just be rigid and have one way of doing things, or you will not be evolving. You will not be doing your process improvement in the midst of an emergency. So this was true in Hurricane Katrina. A lot of the talk, after that event and 5 days at Memorial, the events in this hospital, there was this race to try to find the perfect triage method. And the answer is there isn't one. There has to be preparedness, but then we have to prepare to be flexible. And we did see that in COVID too, some really ingenious types of adaptations and creative thinking that stretched resources. So we need to get out of that mindset of, necessarily having to ration or make these tragic decisions, but also thinking creatively about how to expand resources in a crisis. And I've seen that over and over again, that lives can be saved because of that. One thing that we haven't talked about, and I know this means a lot to you too, but the sort of the inequity in outcomes and the people who suffer the most in these types of situations. And, there are real disparities in the groups, and we talk about socioeconomic and racial, but there's another one, which is disability too. And I was speaking with an expert on this and just the other day, and she mentioned that in her counting, that like more than half of the people who died of COVID in the US could be classified as people with disabilities. And that again gets to this triage and who we value and where we put in the investments to harden infrastructure, to make sure that there are adequate staffing ratios to support health providers. And even, I worked on an article during COVID, just looking at New York City, and the very different outcomes in that first horrific surge that all of us who lived in New York remember in 2020. And the outcomes were very different by hospital. And of course, there's all sorts of factors there. It could be, different patient populations, but
the real key to it is reminding people and convincing people that if you shore up the ground around us, if you shore up the ground around those who are standing on the most tenuous soil, it will strengthen everything. And it's reminding people that investment in those that are most vulnerable, it's not charity, it's smart investment, because it shores up the entire system. There's that old saying, a rising tide lifts all boats, but not if you don't have a boat, and not if you don't have docks and infrastructure. Like, you've got to invest in putting everybody on more stable ground, and that will make the ground you're standing on less tenuous.